So I just want to give you a few updates, and then I do want to leave time for questions if you have it. And if not, I can always give you back time or fill it with more yammering. Generally, for the ERS update, we had a board meeting in May, and there are a couple items that I wanted to give you an update on. First of all, May is our board meeting where we adopt healthcare rates for all the non-Medicare plans. The key part is that because we did not request or need additional funding from the legislature this time for the large Health Select healthcare program, those Health Select rates are staying the same. We did have a pretty significant reduction in the vision plan. So if any of you are members of that vision plan or eligible to be members of that vision plan, they've reduced those rates by 10%. I think they were still trying to kind of vector in the right contribution rate for that benefit. But also, if you are a member of the optional vision plan, please make sure you look at that benefit, because we're finding that people aren't using it. They're paying for it and not using it as much as they should. So I would encourage you to review that benefit if you are have chosen that optional benefit. Dental is going up 3%, so that's kind of also some more refinement. The other thing at the May board meeting that I want to make sure you all are aware of is that, you know, the board of trustees for ERS is made up of 6 members, 3 that are appointed and 3 that are elected from state employees. We only had 1 candidate this time for this election cycle to fill the upcoming seat. And so we had to do some modifications to the ERS election board rules to accommodate not having to do an election, which is quite a bit of trust fund dollars to run an election for a single candidate, but we didn't have a process for just certifying the single candidate as a member of the ERS Board of Trustees. So Nneka Clark will be the new board member starting September 1st. She is a benefits counselor out of Health and Human Services Commission in the Houston area. I think it's gonna be really exciting to have her. She's very young and she's really excited. And so I think it's a really neat opportunity for the board to have her on the board. We're still awaiting an appointment from the governor. So we're down to only 5 board members at this point. That was also probably an important reason for us to make sure we had a way to certify Nneka as our next board member. And so that's our board meeting kind of highlights, but that also transitions us into legislative session and some highlights of bills that I want to talk about. The first of which is House Bill 917, which will allow, so as I just said, our Board of Trustees has 6 members. It's kind of a unique little board. 3 that are appointed, Governor, Speaker of the House, and the Chief Justice of the Supreme Court. So we are kind of a unique state board that has those 3 different types of appointees. And then the 3 public members. Currently, those 3 public members have to be active state employees by statute. House Bill 917 allows for one of those 3 slots, elected slots, to be filled by a retiree. So for the first time ever, there will be an elected retiree opportunity on the ERS board. So that will be the election that's going to happen in 2023. So that gives those of you who may be interested or who want to hurry up and retire, so you can get that slot. So I would encourage you to think about that and start kind of planning a way, if you are going to look at that opportunity for to take advantage of it. I will say that retirees are the largest block of voters the last time we had an election by far. So it's could be a unique way for a different type of member to get onto the board than has been in the past. So yeah. Don't forget the Zoomies. Got the roomies and the Zoomies.
Right now there's a restriction, no more than 1 employee or 1 board member can be from an individual agency.
Correct.
Does that restriction carry over to the retiree? Let's say that there is a board member from a specific agency.
That's a good question.
If the retiree was from that agency,
right.
Does that restrict? Is there restriction?
I don't know. That's a great question.
Okay.
We'll take that back. I don't know that it speaks to it. And so that's a good question. The bill has been filed for a number of sessions and has never quite passed. It's gotten some different pushback at different times. And so I think that's something we'll have an opportunity to look at. And hopefully maybe if we need to, we can fix it prior to 2023. So thank you for that question. I'm going to really quickly talk about a few healthcare bills that I think are interesting for you all to know about. I'm going to just do them really quick. There is some legislation that gives some freedom to high-performing physicians who have to do lots of prior authorizations in order to get certain services. It lets them kind of be waived off from having to do prior auth. So we'll talk more about that as that bill makes its way through kind of the implementation process. There's also an opportunity for those of you who are, this is in the Health Select plan. You know, obviously the Medicare Advantage plan operates under Medicare rules, but the big Health Select plan operates under Chapter 1551 of the Insurance Code. If you're a diabetic, there's going to be a new cap on insulin. So it's $25 per month per insulin prescription, because that's something that I've learned, is that sometimes diabetics will be on multiple insulin products to help stabilize all of their numbers. And so that's a really great opportunity for, especially a state employee who maybe isn't as highly paid, have some opportunity for some cost containment measures. All right, so those are kind of the super high level legislation that I wanted to talk about, that other than the big retirement bill. So before I move on from that and start talking about the thing that we all worked on the most this session, I just want to hit on a couple of those because I don't want to neglect the health insurance. There's also, I'm sorry, one more thing that Ray reminded me to tell you all about. There is a rider in the budget that's going to direct us to do an outside vendor study of our health plan, and looking at, it's very vague language, as budget writers have a tendency to be, that says like evaluate the delivery and alternative methods for the group benefits program. So luckily it's very broad. I think the expectation is that we do kind of a pretty good overview of the healthcare benefits and make sure that they are offering the benefits that you all as our members need and want, and that we are doing it in a way that is efficient and cost saving, has great cost savings as possible. I think that assuming that Senate Bill 321, which I'm going to talk about now, which was the big pension reform bill, assuming it becomes law and is just going to smoothly sail on into the future as an implementation, and we can put a check mark next to the pension issues, I do think next session has the high probability of being a healthcare session, a health benefits session for the employees' retirement system and for state employees. And so I think we're going to want to all kind of make sure we have our homework done going into next session and our feet underneath us on any sort of proposal. There's lots of neat things and good ideas and bright, shiny objects in the healthcare space that are all kind of meant to try and contain costs and reduce utilization and those sorts of things. And so we want to make sure that we continue to offer a comprehensive, robust health benefit to state employees and retirees as part of their total compensation package. And so I just kind of want to put a marker down that I think it's going to be a lot of healthcare discussions next session. So we'll want to make sure that we're prepared as possible next session to engage in that conversation. So before I move on to the big pension bill, do we want to have any questions on healthcare or any of those things before I move on? Okay. All right. So the life of Ann, Ray, Shaq, and myself for the last 6 months has been Senate Bill 321. The only upside is that we didn't know that it was going to be our sole livelihood until about the middle of April, which is real late in session. So it was on a, I don't even know how to describe it. It was like some days it was on an express pass, and then other days it was stuck in a traffic circle and just kept going around in circles. And then it would zoom out and move, and then it would get stuck in a traffic circle again, and then we'd go off the road and into the ditch, and then we'd come back. And again, right now I'm going to say, Ann, we're in a traffic circle because we are waiting for the governor to take action on this bill. So this legislation was passed literally at 11:37 on the Sunday night before Sine Die on Monday. It had to have legislative action prior to midnight that night. So this bill was passed with 23 minutes to spare. And it was on life support at that time, I will say. It was a very courageous move by Senator Huffman on the Senate side, who initially there was a little bit of an amendment over on the House side that got added, which isn't bad, it was just complicated, that we very late in the game realized that leadership wanted us to pull that amendment off. So we all of a sudden crammed in a conference committee report that also then meant that on the House side, we got behind the very dramatic walkout. So there's a timeline, right? So for those of you who've ever had to work on legislation, at the end of session, there's this 24-hour layout rule that an action cannot happen until a conference committee report has been printed and published for 24 hours. We weren't eligible until 11:06, and the House shut down for other non-related, very political reasons at 10, 12. So we were kind of dead again. We were in the ditch again. And so luckily, Senator Huffman resurrected us and brought us back to life at about 11:37. So that's a description of how the bill kind of went through the whole process. What it very high level does is it fundamentally changes the trajectory of the ERS trust fund. We're going to have to still talk about, if any of you are part of the judicial retirement system, we're still going to have to talk about you. The LICO supplemental fund for law enforcement and correctional officers, it's still going to need some help next session. So those are still two trust funds we need to deal with. They're easier to manage. They're a little bit smaller. So 321, it's funny, depending on who's talking about the bill, they talk about the two parts in a different order. I always talk about the money first. So fundamentally, what the bill does is it creates what's called a legacy payment schedule. It commits the legislature to putting in the budget every session and for every year for the next 34 years, $500,000. So $1 billion each biennium for every other legislature from now until 2054. Will contribute will contribute an actuarially determined contribution rate, which at this point is about $500,000 per year. This is in addition to the 10% that they contribute as the employer to the pension plan. So this is an additional money on top of I think it's already $2 billion that they put in every single year anyway. So it's a huge financial commitment that the state is putting into the pension plan to get us actuarially sound. Right now, hopefully, bill passes. Although, can I just say that caveat, if the bill passes, exists in front of every sentence, so I don't have to keep saying it. If the bill gets signed, it means that we will go from a complete depletion date. So right now, the trust fund is anticipated to run out of funds in 2061 to being 100% funded, not just actuarially sound, but 100% funded by the year 2054. So that is a fundamental shift of running out of money to 100% funded. And as I think Ann said before, that means within the next 3 years, depending on how investment returns go and those sorts of things, the fund will be actuarially sound, which it has not been for quite some time. So that's a really exciting trajectory change that is just fundamental that you can't ignore. So it's a huge commitment by the legislature. Now, obviously, sometimes when you get a huge commitment from the legislature, they would like to help stabilize the plans so that they don't have to keep doing huge commitments every single session beyond what they've already committed to do. And so that is what the next part of Senate Bill 321 does, is it creates for new employees moving forward, so only those that are hired on September 1st, 2022 and after, we're going to call them uniquely, you'll be shocked to know, Group 4. Which is just the group that comes right after Group 3. But what this benefit structure is a little different. So it's still a defined benefit structure with a guaranteed lifetime annuity in your retirement. It is referred to as a cash balance benefit. I will say that as much as I'm going to try and explain it to you as kind of a new and newfangled concept, it's actually one of the oldest style of pensions in the state of Texas for the members of the 253 of the 254 counties all have a cash balance plan as their primary retirement plan. And 800 municipalities around the state also have a cash balance plan as their primary retirement plan. So as much as it's an innovative stabilizing factor for a state retirement for the ERS system, it's a plan, a type of benefit that has been around and is well proven. So we wanted to be really careful that we didn't make people think that we were an experiment, because the experiment has happened. It works well. TCDRS, the county and district, and TMRS are both very well funded. They're both actuarially sound. So it's a solid benefit that has been tested in the state. And so what it does is the employee makes their contribution every single month, their contribution of pay, which we're going to get to the specifics here in a second. And it goes in, it doesn't really go into like a separate little account. We're not going to have 100,000 different little accounts. It's an accounting of, right? So in a ledger somewhere, you will get your account contribution every single month. So you'll make your contributions every single month as an employee. These future employees will. And then every year, the state guarantees that your account balance will grow by 4%. So there's a guaranteed growth of 4%. And then on the years that the ERS investment trust fund and the investment teams outperform on average, that 4%. And just as a quick point of reference, our asset allocation and our investment goal every year is 7%. So the likelihood that we will do better than 4% is pretty good because we're aiming for 7. So in the world of aiming for 7, you hope you get 4 most of the time. And so when that every year, when your 5-year average is greater than 4%, those employees' accounts will grow by at least 3% more. So it's capped out at 3%. So what it means is state employees' account balances will grow by at least 4% for sure, and maybe 7% every single year. And it just keeps growing and growing and growing and growing and growing, which is, compounding interest and those sorts of things all work out very, very well for you. At the time of your retirement, the state will look at your account balance and they will match it at 150%. So they'll grow your account by 150%. And then they'll look at actuarial factor tables and they will determine what your lifetime annuity is going to be. And that will be your monthly amount for the rest of your life, regardless of whether or not you live less than what the actuaries thought you were or more than the actuaries thought you were. You will never run out of a retirement annuity. That's a very important component. The other part of this concept is that once these Group 4 retirees do retire, they have the opportunity for their annuity to increase every single year as well by that gain share. I'm sorry, I didn't call it that. So there's a 4% guaranteed interest and the 3% gain share when we're over 4%. All of their annuities can be recalculated every single year by at least by no more than 3%, but never less than 0. So it can't go down. It can only increase. So that means that these Group 4 retirees will have a little bit of a version of a built-in cost of living adjustment where their annuity will grow in their retirement age. And they, in the future, will not have to constantly be asking the legislature for ad hoc adjustments when the fund is sound and when the money is available. And so that's a really great stabilizing factor for those future retirees. So that's the big and the small of it. The other really important thing I think for you all and for a current initiative that you have as an organization is that we were able to design this benefit with our actuaries so that it has all of these components in it, and state employees will only have to contribute 6% a month as opposed to 9.5% a month. So that means that state employees that start after September 1st, 2022, essentially are going to get a 3.5% take-home pay increase, which is an enormous benefit for those state employees moving forward. And so it's, you can't claim it as a pay raise, but for those employees, it's, and they won't have gotten it the day before, so they won't know it, but they're essentially going to be taking home 3.5% more of pay than state employees from August 31st, 2022. So I think that is a game changer in your ability to talk about employee recruitment and retention, because I do think that state employees and state agencies suffer. Kind of a lot of state employees all of a sudden look at that first paycheck and realize how much has come out. And so by reducing that monthly contribution rate, maybe there's a little less of that first month shock or take-home pay disappointment that I think sometimes can happen. So anyway, did I get it, Anne? Are those the 321 components? Sorry. Oh, Ray. Yeah, no, I'm sure I'll do questions. And I will say, I'm going to say one thing as Ray's making his way up to the microphone. Go ahead. So we met with Dr. Bonin, who carried the bill in the House, quite a bit there toward the end when we were doing lots of traffic circles and in the ditches and coming back out. And he kept saying, I keep walking around the Capitol. And he said, I don't know who all these people are, but they keep coming up to me and saying, thank you so much for carrying the ERS bill. Thank you so much for carrying the ERS bill. It means so much. And my suspicion is that it was just Ray over and over again in just different outfits. And so I think that Ray maybe possibly just kept doing like costume changes in the Capitol.
There is some truth to that.
Dr. Bonin was just like, I can't walk anywhere without getting thanked for carrying this bill. And so I think
as long as he didn't think I stalked him.
He thought it was a different person every single time. But I do, before Ray asks, and I want to take this opportunity, and you all have done it already in your recognition of Anne, and I want to make sure Ray gets lumped into there. You all have to know that there is no way a bill would have been introduced, would have made it out of the traffic circle, or gotten up and out of the ditch if it weren't for Anne and Ray in this organization. Anne and Ray were instrumental in putting together that state employee, the disparate groups and coalitions together in one. as much as possible. We had a couple go rogue on us, which is fine. But it was the ability for Anne and those other organizations to really have a voice in this process was fundamentally different this session. And that is an absolute something that Anne and Ray and your organization needs to be commended for, because without it, I couldn't have done my job, and hopefully, knock on wood, or whatever this is, we don't have to do it all again. But I will say that if I have to, I have every confidence in the world in our ability to just do it all over again, because it was a work of art that she put together and should be commended for it. So yes, sir.
Wow, back at you, Jennifer. And what a tightrope act Shaq and Jennifer had to do all through the session, because they did have to opine about this legislation to numerous folks, and a lot of credits due to them. Let's give them a But one question: there are a lot of folks in this organization who are they participate in LICOs.
Yeah.
Would you comment?
Yeah. That's a great.
And elaborate on the LICOs implications as far as their benefits.
Yes.
And
under
also
the new
define
plan.
LICOs.
And
Yes, I'll do all these
LICOs is the
things.
law enforcement correctional officers.
Actually, it's not, because that's a funny story. LICO. Yeah. So a couple things. The benefits for these state employees moving forward, the new ones in September 2022, 6% contribution instead of 9.5%. This new benefit also has a vesting period of 5 years, which all of you in this room, if you're group 1, you're like, what's the big difference? Guess what? Group 2 and group 3, it's 10 years. So that is a huge change for those individuals, that they actually vest for a benefit after 5 years. You individuals in this group 4 are going to be able to actually retire if they hit the rule of 80 without any sort of actuarial reduction, or they can work for 5 years and they will have as long as they leave their money with us, they will have an annuity benefit waiting for them at the age of 65. And the reason that it's actually a really good benefit for even those short-term employees, is that the upside of the cash balance plan is that your account balance, as long as you leave it in the plan when you leave, so if you leave state service and go do something else, as long as you leave your account with us, it's going to continue to grow by that guaranteed 4% interest and that potential 3% gain share. So those individuals who may take a short break in service to have a family, I think it provides a unique opportunity for state employees to feel like they can go work in the private sector for 5 years, gain new skills, new experience, and then come back to the state with that experience from the private sector into the public sector, and your account continues to grow even if you're not actively employed. And so that means that you have a retirement benefit waiting for you at the time of your retirement. So I think those are some other big parts. But LICO is actually the Law Enforcement and Custodial Officers Supplemental Retirement Fund. And the only reason I say that is because I have a friend who doesn't work in state government, and there was a news article about 321, and they were talking about the LICO benefit. And she said, I'm just so confused as to why the state would prioritize DPS troopers and custodians so much. I was like, oh yeah, that's not what that is. That's a correctional officer. So there is a LICO benefit that allows individuals in those higher risk jobs, like a DPS trooper and a TDCJ correctional officer, to retire at an earlier age with fewer years of service at a higher multiplier, is what it is for groups 1, 2, and 3 today. And we have maintained a LICO benefit in this group 4. So they will still have the ability to retire as soon as they hit their 20 years of LICO service. They can retire exactly at 20 years of service. They will be making an additional contribution, just like they do today, into the Supplemental Retirement Fund. That's an additional 2%. And then that is going to be matched at 300% at the time of their retirement, combined with the other regular employee little account that they're going to have growing as well. And that will become their lifetime annuity. So there is a supplemental enhanced benefit for those high risk individuals, continues into group 4. So thank you, Ray, for reminding me of that. All right, I'll stop. I feel like that's the worst lesson on a cash balance ever, but that's where I am. So can I answer any questions about the bill, about anything? Yeah, sure. I think they can.
Yeah, you need to for the,
So all the other
Zoom.
Zoomies can hear it.
we have a Zoom question. It's a touch screen, Gina, you can.
Sorry. The first question is from Cynthia Hale. If employees leave state employment, but leave their funds in their retirement account, then later return to state employment, do they still retain their original pension, or are they forced to move to this new plan?
Good question. Okay, so if you're group 1, 2, or 3 today, and you, so the answer is it's the same as it is today, which is if you leave employment and leave your money with us and come back, you'll come back as whatever you were before, a 1, a 2, a 3, or now a future 4. The difference, or it's the same moving forward, but if you come to state employment, leave state employment and withdraw your funds and come back, you come back as a group 4. So it is the same as it is today, where if you are 1, 2, 3, 4, or leave and come back, you are 1, 2, 3, and 4, as long as you leave your money with us. So.
Thank you. And the second question is from Stella Fair. She's asking, what is the risk of this type of retirement plan for group 4?
The risk to the members, I wonder, or to the. Yeah. Okay. So we'll say, and because I think that there sometimes are conversations about shifting risk to the member, right? And that's a lot of conversation around when there are debates on defined contribution plans. And the first thing I'm going to say, which is not an answer to this question specifically, but as our actuary in training has taught me literally just yesterday, is that it is a misconception that there's no risk in the plan you have today as a group 1, 2, or 3 person. And the greatest example of that is the fact that there's a group 2 and a group 3. So the risk that you have staying in an underfunded or a defined benefit plan that has an unfunded liability for you as an employee is that all the benefits you've earned up until the present day have been guaranteed. You've worked that day understanding what that day's benefits are. But there is always the risk that the legislature could change the benefits moving forward in order to stabilize the plan, your own benefits. In the past, they've always made it for new employees, but they can always change future benefits. And so Ariana, our actuary in training, always reminds me to say, there's currently risk. It's just, you didn't know it was there until you're past it already, right? And you look back and you're like, oh, crud, I didn't realize that my future benefits were at risk. So the good thing about a cash balance benefit is that you know exactly where the risk is ahead of time, and it's transparent. The risk exists, I don't know if that's me, the risk exists that you're always going to get a guaranteed 4%, but because the asset allocation for our investment team is always aiming for 7%, the likelihood that we're going to get 4% is really great, right? And so the guaranteed 4%, that minimizes the state's risk, because right now benefits are being accrued on an assumption that we're earning 7% and paying for benefits that cost something that requires a 7% interest return. Does that make sense? Whereas now the state only has to be at risk for that 4%. And that you as an employee, your risk exists as to whether or not your gain share each year is only 0, which is not nothing, that is not nothing, which is nothing, or is it 3%? So the risk exists in only upside sharing risk, right? So when the fund does really well, you can get up to 3%. When the fund doesn't do as well year over year, all that happens is you don't get the gain share, but you continue to get the 4%. And because the state's at less risk because they're only guaranteeing 4%, the likelihood that the plan gets new unfunded liabilities is much lower because everybody has lowered their risk. The employee's risk is much more transparent, and it's in front of you rather than risk that's behind you when you didn't realize the fund was falling apart and your benefits were about to change. Does that make sense, what I'm kind of saying? So I think sometimes there are concerns that we're shifting risk entirely onto the employees with a benefit change. And I guess what we're trying to say is the risk was always there, that your benefits could change or you could lose the fund altogether. And what the Group 4 benefit does is it makes that risk much more transparent to you as a member. And you can see it coming, you can plan, and you can participate in whether or not that 0% is happening or 3% is happening. So that's my very loose attempt at explaining an actuarial something in a way that I think I understand that hopefully can be helpful. So it is not a total risk shift. It is a shift to a much more transparent risk is what I would say. So, but it is not all the way to a defined contribution where they say, here's your 6%, go for it and good luck. So.
Hey, Jennifer, you went to a lot of details about the difference between the cash balance plan and some of the other groups, for instance, the rule of 80
Yeah.
versus a minimum retirement age, contributing 6% instead of 9.5%.
What did I miss?
The gain share, you didn't miss anything,
Okay.
but I just, one of the questions that we get, and I'm sure you get as well, is if you are currently in group 3, which is not as rich of a benefit as groups 1 and 2, you have a minimum retirement age.
Yes.
And I think during my testimony, I testified something to the effect that if you went to work at 25 years old, you're really making the rule of 102
yeah.
instead of rule of 80. So we get the questions, and you do as well. Would you please address whether or not people in existing group 3 can join group 4?
Yeah, so it's interesting. This is the evolution of describing Senate Bill 321 is that, oh my gosh, it's horrible. This is the worst thing that's ever existed. And then you kind of explain it and they ask lots of questions. And then this is legislative staff, I should say. And then they would say, oh, I'm group 3. How do I get into group 4? So I'm hoping that as we're able to, if the bill gets signed or becomes law, that we're able to do a lot of education to make sure people understand that, and I think Anne described it really well when we had our bill hearing, is that it's kind of a modernizing of the benefit, right? And it's trying to figure out a retirement benefit that fits the workforce that exists today, rather than trying to recreate a workforce that maybe isn't out there anymore, that for anybody, right? I don't think the Ford Corporation has people that come at 20 and stay until they're 62 anymore. I think it's just a different world. That's not what you asked, though. The question about group 3 to group 4 is something we're going to be looking at. There are lots of tax implications. We are authorized under the IRS code, and the IRS has lots of rules about benefits that they want to make sure that we're not, and they're good rules, right? They're things that want to make sure that we're not favoring highly compensated people or being unfair to lower compensated people. And so we are going to spend, if the bill becomes law, we're going to spend some time also in this implementation period doing some legal and tax research to see if it's a possibility for us to have conversations about allowing, requiring, talking about group 3 individuals who may want to actually participate in group 4 instead, because for some of them, it may actually work better for them in their career that they see themselves having, both with the state or with the state, and sometimes not with the state, but sometimes again with the state. So we're going to try and figure out a way to talk about it and not jeopardize our plan's tax status, which is like, you can't do it. It's list number 1 is don't jeopardize your plan qualification status. So we will be having those conversations if the bill becomes law.
And so that's a good lead into my next question, is just to remind people the 3 options the governor has.
Yeah.
As far as the bill.
Yeah, the
is
3
concerned.
options that are currently taking a really long time. So for bills that are passed toward the end of session, in the last 20 minutes, he has 20 days from sine die to sign that piece of legislation. So that will be a week from tomorrow, Father's Day, June 20th, is the deadline for him to take some action on all legislation. So he has 3 options, as Anne has alluded to. He can sign the legislation, which would be super duper. He can veto the legislation, which would be real, real sad, but we'll just do it all over again. Don't you worry. I don't think it'll go away. I do want to say that I think that this is something that enough of the legislature and leadership have engaged on. If we end up in the ditch again, we'll just pull ourselves right back out, and we'll, I suspect, continue to have conversations about it. The third option is a bill can become law with no action. So if he doesn't affirmatively take a signature action or a veto action, it becomes law without signature, which is kind of like allowing it to become law while you're holding your nose kind of thing. So maybe it's not exactly perfect because, it spends $1 billion, or it has kind of our little tag along amendment that came along, or it's just not, honestly, I don't know that they can process enough bills from a timing perspective to get an actual signature on every single one. So sometimes you just get put in a pile that's just like, let them become law without getting signature just because the stamp is worn out. So that's sometimes, I'm going to say that's true as well. So anyway, so those are the 3 options. We will know our fate by next Sunday at midnight, hopefully prior to 11:37, because I can't do it. I gotta know.
That would be nice.
Yeah.
The final comment I have is actually a comment
Okay.
and not a question, and that is, my comment is that when the bill was presented during the committee, we had TPEA as well as the other groups, didn't have a lot of time to see the bill before we actually had to testify or comment on at the hearing. But shortly after the hearing, we did cautiously endorse the bill, TPEA. But shortly after the hearing, we convened the Board of Trustees. We briefed them on the bill. And I will say, and I appreciate that the Board of Trustees unanimously endorsed the bill. And we were an early adopter of it because we knew what it did for the trust fund as well as for state employees. So board, I appreciate that, and I wanted the members to know that, because not all organizations did that. And not all organizations were for the bill for various reasons, and that's their prerogative, as Jennifer said. But because you did that, it allowed us to be very aggressive in terms of getting this bill passed, and I appreciate it. And we also, again, appreciate Shaq Nail, who I've known since 1980 something, when he was executive director of the dental board, and Jennifer, who I met when she was Senator Duncan's legislative chief of staff. And so we appreciate their efforts on this as well, knowing that they have to walk a very fine line. So thank you so much. From my standpoint, of having dealt with retirement and implementing retirement programs over the past, it's as good of a bill as you can get during a session. It checks all the boxes about what a good retirement bill is. And that includes a lifetime annuity, guaranteed interest rates. It does check a lot of the boxes. And if you look in your book, as well as we have a book over here of some of our correspondence we did with the legislature, we'll pass it around so that you can look at it. It was a masterful job between the senator and the House member, as well as ERS, in implementing or drafting the bill. So thank you.
Had nothing to do with it. Just the happy shepherder. So anyway, is there anything, I know I don't want to be careful of your time.
That's
Jan, did you want to ask something in particular? You can, if you want to ask, I'll repeat it.
Thank you, Joe.
I'm not sure if this is the best question for you or maybe Ray for his legislative update, but is ERS getting any questions from the governor's office about the bill since it hasn't been signed?
Yeah.
Or any insight as to what might prevent the bill from being signed?
Yeah, I mean, I will not opine on, mostly because I don't need to put that sort of karma in the world about why he wouldn't sign it, because I think it's a good bill. I will say, just from my years working in the legislature, is you just generally don't count your eggs before they hatch, just because I think you need to always be really careful. And it's part of the process, right? So I try to be really careful that I would never say a bill has passed the Senate before it actually has, right? And so I don't want to alarm anybody by my cautions about, being respectful of this step. So I don't know that you should take it as anything more than that. You can have conversations during lunch. There were some amendments that weren't quite vetted that maybe will cause some pause just because it didn't get a review. Anyway, so I think that we have communicated with them. We've provided lots of information. I know that lots of stakeholders have provided information to the governor's office, and they kind of put together a giant packet, and it makes its way through a pretty extensive review process inside the governor's office. They bring in people who weren't involved in the legislative process to kind of do a once over, because as I all of a sudden sometimes forget, it becomes actual law, like legal law. So every bill gets a pretty thorough review inside the governor's office. And so I don't think there's any reason that we haven't heard anything yet, to be perfectly frank. I think that they get a couple thousand bills all of a sudden at midnight on a Sunday night, and they're expected to take action on all of them in 20 days. And so it just, sometimes you take a while. If we're in numerical order, we're toward the end anyway as well. So I, have provided them with as much information as I possibly can in an informative way. And I'll let Ann and Ray kind of talk about if their awareness of what some of the stakeholders have done. So.
Yes, and I can comment on